Can stress lead to infertility in the woman? And one more question, doctor. What does ovarian aging means? What tests are done?
There are two good questions and both of them are quite separate, but I'll try to answer them first one at a time. Yes, stress has a major role to play in a woman's capacity to conceive. It indirectly and directly affects the ovary. One, with stress, the ovulation gets affected. The normal pattern gets affected, the woman doesn't ovulate, or ovulates bad quality eggs, or has an environment that is not good for implantation. So, this is how stress affects. Indirectly, it can affect because she does not feel like wanting to have intercourse, which is the right way to have a baby. Thirdly, there are hormones that keep on going up and down, which further decrease her chance in the subsequent cycles of conception. So, stress is a major area which we try to correct if possible. With today's lifestyle, it appears more difficult, but one of the suggested treatments, even when they go for advanced treatment like IVF, is to try and decrease the stress. Now, the second part I will come to is the ovarian aging. Now, there are various tests that have started coming in the market to check about the ovarian age. So, as much as a woman would say, my age is so and so based on her Aadhaar card or her date of birth, there is something called as the ovarian age. An ovary may not exactly correspond to her biological age. Suppose a woman is 35-year-old. We would say she has good 5 years left before which we should think she is worried. But if her ovaries are tested by a test called AMH, which is done in the first half of the cycle, sometimes we find that her ovaries actually correspond to 39 or 40 years of age. This means a 35-year-old girl actually has a 39-year-old ovary. So this is when you have to understand that the ovary may be actually showing signs of aging prematurely. A lot of terminologies like premature ovarian aging, decreased ovarian reserve are used to explain this. Tests are done. Two things I want to caution you about. One, quite a lot of this happens because of many factors which can be corrected with antioxidants and some drugs. Also, if I see signs in a 35 or such a age woman of premature ovarian aging, I will accelerate her quickly through treatment like IVF. I won't waste time. So it is important to identify it quickly. So a typical doctor will be able to tell a woman when she should not waste time, even if she is appearing to be younger. Also, it is important to know whether the ovarian aging increases faster. So ovarian aging is a new modality that has started becoming a very regular part of treatment for infertility.